Hello again, and thanks for staying with us. So, member states at the 75th World Health Assembly have agreed to adopt a landmark decision to improve the World Health Organization's financing model. That assembly sat earlier this week. Some of the recommendations include broadening the financing base of the WHO, which some experts fear that the existing funding model or strategy poses a threat to the WHO's independence. Let's make sense of this for you now. Bring in Attiya Waris, who's Professor of Fiscal Law and Policy at the University of Nairobi, who joins us now via our video link. And Prof, it's great to have you on the program. Thank you so much for your time and patience. For those perhaps who aren't following this quite closely, help us as a start place why the WHO's modeling financing model in its current form is potentially problematic.
Thank you very much for having me, Ayanda. It's really a pleasure. So the WHO, the way it has evolved over the years, has had a lot of difficulties with securing funding. So, for example, even based on the article that myself and a group of colleagues published in the Lancet in March, we point out the fact that its budget is the size of a big research hospital. Now, when you understand that that is the size of its budget, then you realize that a huge chunk of its money comes from outside sources, which are not from membership dues from states that are members of the WHO. Now, the result of that has been, and it's a constant battle, I've been working on this issue for over 15 years and have published on it in the past, is that the decisions on where the money is spent and how it's spent is not necessarily in line with the priorities of the WHO, or not necessarily in line with those global priorities that we all need. And if I give you an example of previous crises like the Ebola crisis, you need to have money moving into those spaces very, very quickly. And if all your budget is tied to decisions by outside spaces, then those medical professionals within the WHO, who should be the ones leading on the financial decision-making process, actually are not part of it. And this is the historical problem now facing the WHO going forward, but we're so delighted that they're going to reconsider this.
Yeah, we'll speak about that in just a moment, what this reconsideration potentially looks like. But who are these outsiders in the main who are donating the bulk of the WHO's money?
So the bulk of the money seems to be coming from private foundations across the world, and some countries do give additional donations of funding based on crisis, on a need-to-need basis. The result of it is also then a very unstable funding source for the WHO, and so this needs to be stabilized as well.
Yeah, the WHO, by its very nature, is not a profit-making organization, or at least shouldn't be one. In that context, then, how does it try and attract money without compromising its independence and potentially its integrity?
Well, there are multiple ways of doing it, but some of the work that I've been doing since about 2015 is trying to understand where it could get money from. So if we start at national level, countries at national level on the African continent, based on the Abuja Declaration in 2001, are supposed to commit 15% of their national budgets to health at a domestic level. But on the African continent, only 5 of them are even doing it. Then you're supposed to give membership dues to the WHO based on the size of your economy. That still doesn't answer the need. It's about how much you have to give. So there have been huge calls, and I work a lot on issues around illicit financial flows. And one of the problems that we are noticing is that the reason countries are so strapped for cash is because they are not able to collect adequate taxes from their populations because of the international financial flows taking place. That is causing a lot of leakages in systems. And the figures on IFF are in billions of dollars. On an annual basis, on a 20-year basis, the data keeps showing this. So there are many ways of getting these finances. Increasing how much revenue a country collects means that much more membership due for the WHO, as well as other international institutions that provide services like this. And then on the other hand, we can get those that donate to follow a set of rules or regulations, which allows the organization controlling the money to actually make the decision on how it's being spent. And this is what they're going to do going forward.
Okay, that's good to hear, because that was essentially my next question. I mean, is there an appetite to change the current model? Because we do know that typically politics is not too far removed from these multilateral organizations. And in that space, we know that there's always someone's interest that's being served in any context.
Yes, so we finally have appetite. I think if there is one thing we are celebrating this week is that the appetite is now able to express itself in the political spaces. So these have been global calls going on for 15 to 20 years in multiple spaces with multiple ideas on what it could look like. But unfortunately, the global political appetite was not there to actually begin to roll it out. However, in this COVID era, when the reality on the ground is so obvious as how important the WHO has been in this process and continues to be, now the reality of how much money they need is becoming more and more crucial. So countries are coming together. Of course, there are going to be countries that are concerned about state sovereignty issues. It's been an ongoing conversation as well. But I will repeat what I've said in the past, which is we have to focus on the human being and keeping the human being alive. And that is what the WHO is there to do. So we really need to push as much as possible to ensure that they get what they need.
Yeah.
And they are doing it. And of course, we are writing a lot of research on it, so hopefully it will help.
Yeah. Of course, COVID-19 has, I guess, shone much more of a spotlight on the WHO than anything else in the past. I think it's quite safe to say. But it's interesting to note how the WHO sometimes feel it's not being heard. You know, a lot of conversations at the start of the pandemic about whether or not the organization spoke out loudly enough at the beginning, whether they were quick enough to respond. The WHO on its part coming out to say, we did actually raise the alarm, but it appears we were flatly ignored in some instances. To what extent do you reckon even just the, I guess, changing of this financing model will allow the WHO to, I guess, have much more of a louder presence, so to speak, and be taken much more seriously than it currently is?
So one of the problems when you're dealing with tied funding is that the person who calls the shots is the person giving the money. The result was that I think that when they were speaking out on those issues, they weren't now in line with what is the normal way of operating from the perspective of their private donors. And the result was that they weren't given the space that they needed to be given. I think that the way COVID has rolled out and the, frankly, fantastic job that Tedros has done in this process has shown that the medical specialist has to be front and center in making these decisions. And I think that this is why we are now paying more attention to them. And I think it is important. I think it is what the reforms are going to aim at. They're finally going to pay more attention, and the donors have actually, I think they have to rethink their own model on how they've been giving funding, and they have to also make sure that it is medical personnel and specialists who are front and center in helping with those decision-making processes. But the political controversy around when someone speaks on a particular point, that is a problem in all international institutions around the world. So hopefully with the WHO things will get better, but it is a shared reality for leaders of international institutions that work on crisis issues.
Attiya Waris, lovely speaking to you. Thank you so much for breaking it all down for us. Really do appreciate your time. Professor Attiya Waris is a Professor of Fiscal Law and Policy at the University of Nairobi.